what, 10 days into the new year. Peak flu season hasn't even hit, and we're already seeing alarming reports about this year's season.
Yeah, the flu hasn't yet reached epidemic proportions, but the CDC says it could. So how about if we can't get ahead of this year's flu season with helpful information? And PRMC's Chief Informatics Officer and hospitalist Dr. Snyder is back with us for the very thing. What have you heard about this year's flu?
Yeah, it's fairly large. We kind of anticipated it because over in Australia and New Zealand, they had a fairly big outbreak in August. So seasonally, we were expecting something. So there is a fair amount of divergence per CDC of the virus. So flus are caused by a virus. So it's not a common virus, but it is a virus that can mutate. The year before, we tried to determine what next year's flu bug is, and that's what's part of your flu shot. So that does help prevent it significantly. So getting your flu shot is a big thing. And I know at PRMC, all the employees, even the physicians, we all get flu shots.
Right.
It's a requirement. So so it is a good thing to get that flu shot, but it's a fairly significant bump in December now. In January so far, it's dropped a little bit, but we'll have to wait and see. We're still early and continue to look for those signs and symptoms.
So what constitutes a bad season versus an epidemic?
Yeah, there's numbers the CDC uses, and they have a math based on population and per capita. Not sure if I understand 100% the pop health around that, and it's kind of a moot point. I think the fact is everybody should be practicing prevention, whether it's a high flu season or not, and I think that's our key here. So, you know, whether it's an epidemic or not really is kind of a scientific measure. So I think the really important thing is day to day, if we all take control of our personal hand holding and make sure that we're actually washing those hands, practicing those good activities with diet activity, avoiding alcohol, cigarettes, all those good things. And then when you do get sick, preventing from going into an environment where you could infect people is always good practice. So
yeah. So Lisa and I got our shots here on the show just a couple of months ago. Is that going to protect us from the predominant flu strain?
So the predominant flu strain actually is not protecting folks at this point. So because we have folks with the flu shot who are getting it. Yeah. It depends. There's multiple strains of the virus, and depending on which one mutates, it will be depending on if you get sick or not.
Okay, so let's talk about treatment. I know that Tamiflu is used often at the hospital and doctor's office. Is that going to protect us, or at least give us some relief if we do get it?
Yeah, the antiviral agents, usually we look for a 48-hour window, so based on your symptoms. And remember, the symptoms with this, it's not your common cold symptoms, so it's not going to be runny nose, cough, mild aches. It's going to be rip-roaring fevers of 103, 104. So high temps, typically you got that sore throat, the upper respiratory, and massive achiness everywhere. You're miserable. When those folks get those symptoms, get to your doc early. Tamiflu given in the first 48 hours, it doesn't reverse it, but it will reduce the replication of the virus. So it actually will hopefully shorten the time frame. So that's more of the benefit of it. It doesn't treat it, not like an antibiotic treats a bacteria.
Gotcha.
Okay, look, I don't want none of that. So are there precautions that I can take to try to keep myself protected from the flu?
Well, again, hand hygiene, diet is so important. So good nutrition, avoiding the irritants like smoking, alcohol, anything that's going to affect lowering your immune system. And then if you go into an environment, you know you're sick, you know you're a diabetic, you know you have emphysema, you know you have cancer, going into an environment where you know there's flu, like a hospital emergency room, you know, avoiding those environments at all possible. Children are another group who tend to carry it and may not get as sick because they have nice immune systems. So if you're around grandkids and stuff, just make sure you wash your hands real good. And again, the basic bleach the world.
Yeah.
Now, there's some news reports out saying that there is a shortage of IV bags, and staying hydrated is how people are treated when they get sick.
Yeah, you know, we've had a lot of outages this year. Part of it has to do with a lot of the weather occurrences down in Puerto Rico. There's a fair amount of drug distribution that comes out of there from a manufacturing standpoint. So there's a lot of meds, and we constantly, as a hospital, most hospitals have P&T committees that look at those things on a regular basis.
P&T committee.
P&T, I'm sorry, Pharmacy and Therapeutic Committee. So it's a bunch of clinicians that sit around and determine, you know, if we have shortages, what are we going to do about it, so we can ensure there's enough. So we'll do compiling of what's available, what's not available, and then we also educate and put in alerts for alternatives. So to answer your question, yeah, there was a small bag fluid delivery process that didn't occur. So we are short with those things, but we just use larger bags. Unfortunately, it affects cost, it affects a lot of different things, but there are alternatives. So we'll have fluid. Salt water, if not, we can go to the ocean. No, we would never.
You got plenty of that hanging around still.
Thank you
You're the
so
man.
much.
Thank you.
That's good information.
Thanks, Shirley. Yeah,
Sure.
good stuff.